Hi, I'm Eileen McGovern and I'm one of the Community Committee on the Save Our Acute Services campaign group. And we've just come from the Department of Health building where we handed over 28,494 responses to the latest consultation from the Department of Health. And those are the responses from the good people of Fermanagh and South Tyrone who are, like ourselves, adamant that our emergency services are restored to our South West Acute Hospital and that our state-of-the-art hospital is used to its maximum capacity. It's absolutely unthinkable that in this day and age when we hear nothing every day but the pressures that a hospital, that there's no capacity here, there and yonder. We have 92 beds in our state-of-the-art hospital that have never been used and 2 theatres that have never been commissioned. So I feel that people of Fermanagh and South Tyrone have spoken loudly and they are not going to be ignored any longer. So our Minister of Health and our Department of Health need to listen, sit up and listen that the forgotten people of Fermanagh are not going to be forgotten anymore. We have very, very poor infrastructure in order to get to where we're told to go, which is to Athnagelvin in the event of an emergency. And we have several tales gathered, several stories from people who have had dreadful experiences between the lack of emergency care in Fermanagh, but also the lack of Northern Ireland ambulance personnel able to accompany them to emergency services in Athnagelvin. From my home, that's over 2 hours and 20 minutes, and that is not a safe length of time to transfer anybody. That's if you are accepted when you go to Athnagelvin as an emergency patient. Unfortunately, we have had to endure, and we know of many, many people who have had to endure double ED. So they've done emergency care. They've waited in A&E in Enniskillen for multiple hours due to the pressures that's there, and then they're transferred sometimes in the back of a family vehicle, in the back maybe of a Coastal Corps ambulance or an ambulance that is not staffed by paramedics, which is unsafe, and they have to join the A&E there, and it is not safe, it's not acceptable, and this is our day to tell the Department of Health that we've had enough and we're not accepting it anymore. So we look forward to the restoration of our emergency services and all the other services that have been stripped away from our hospital.